This may look like cluttered chaos to you, but to a busy healthcare professional, it's valuable, navigable, and the way patient records have been kept for decades. The Health Information Technology for Economic and Clinical Health Act, or HITECH, is already changing all that. By 2020, up to 90% of providers will, by government mandate, have moved to electronic records. But getting there is definitely not part of the fun.
Well, I'll be honest, we've had some ups and we've had some downs, and I think that that's very true of any medical practice that is in the process of converting from a paper environment to a paperless environment. I haven't met a single person who's gone through this process that hasn't had some highs and lows, and we are all the same. However, I will say that as we get more and more into the process and you get more used to how it works, it's working better and better for us and more efficient.
So unappealing is the process of moving to electronic records, the federal government has set up incentives. To qualify, a provider must engage in 90 days of meaningful use within 1 year of starting the transition process, and before January 1st, 2014. Meaningful use is just that, actually using a new paperless patient record-keeping system. And while many providers are daunted by the size and scope of this shift, the benefits can be equally enormous. Not only is there federal government incentive, but offices will experience increased productivity. Record sharing among them will be nearly instantaneous, and patients will be able to access their own health records from wherever they are. So what's the problem? Imagine a closet cleaning job on steroids. Moving all these records into electronic form is first and foremost a very big job. Then there is the cost, and it's not a small one, of adding or updating equipment. Time challenges will also be significant. Providers have to maintain their practice while converting the practice's lifetime of paperwork into digital form. And finally, everyone, including patients who may now have to fill out electronic forms, will need to be trained. So when CNY Cosmetic and Reconstructive Surgery Practice first began the process, they quickly realized that this was a job for the experts at Cortineo Business Technology.
I interviewed multiple IT providers before I decided on using Cortineo Business Solutions. My decision to use Cortineo was based on several factors. Number one, they are a local company, which I did not want to have an IT provider in a remote location because I wanted somebody at my fingertips, whether that was truly needed or not, 24/7, 365. And that's clearly what we've been provided here in the office. I also wanted somebody who was who could easily work with both Macintosh and PC-based computers. As the rise of tablets continues to grow and the popularity of the iPad, the software that we currently use has a application now for the iPad. So how is that going to integrate with the PCs that we have up in the front end of the office with the tablets that the providers are going to use? And quite frankly, Cortineo has been excellent and has been able to handle all of the issues quickly here in the office.
Cortineo follows 4 basic steps to a successful move to EHR. First, evaluate the current situation. What technology does the practice have? What does it lack? What are its goals, budget restrictions, and the size and scope of the practice or facility? Assist in speccing and purchasing the right equipment, hardware, and software for each practice. Cortineo has the expertise to adapt to the needs of each unique situation and can save your practice a lot of costly mistakes. Install and set up the new equipment and software. Getting it is one thing, getting it right is another. Cortineo won't just dump a box of new toys on your doorstep. We'll be there as long as it takes to be sure everything about the new installation is working for you. Finally, Cortineo will train and remediate the entire staff. Learning a new system can be challenging, but we'll not only train all your users, we'll continue to work with them till they're comfortable and proficient. Cortineo visited with the physicians and staff at CNY CRS and determined that for their needs, in addition to a basic shift in how records were kept, there were 4 important objectives to satisfy. Easy documentation of records using voice recognition software. Records can be entered quickly and easily using drag and dictate. Remote access to the system. giving providers the ability to dictate records and manage patient accounts wherever and whenever, office, home, or hospital, best suits their busy schedules. An on-site server that Cortineo can troubleshoot and manage remotely, assuring low to non-existent levels of downtime. And finally, daily records backup, adding further reassurance to doctors, staff, and patients that their records are safe and secure.
Well, in the past, there was a lot of downtime because the patients would be put into the room, the nurses would do their intake, photographs would be taken, photographs would have to be printed out, the photographs would have to be put into a plastic picture holder and then into the chart. So there's so much downtime that is wasted in doing all those variable steps that we don't do anymore. What I mean by that is the nurse's notes are right into my tablet, into the computer. So I can look and see exactly what the patient is there for, the blood pressure, and all the other vital signs right in front of me. Second is that the photographs are taken digitally and they're now part of the medical record, so we don't have the cost of printing photographs. I don't have to waste nurses' time printing them out, sorting them, and putting them into the plastic holders any longer. So I think from a productivity perspective, it's certainly increased the productivity of the office and made it much more efficient. And I think patients pick up on that. They think that you're running a good show, and they like that.
And what's in it for CNY CRS? First, incentives. The earlier the switch is made, the more the federal government will kick in to offset the initial outlay. Second, increased efficiency. Everyone at CNY CRS will spend less time with paperwork, see an improved workflow, and will have greater flexibility and constant access to records. Third, and most importantly, the entire medical team and staff at CNY CRS will be able to spend less time in record keeping and more time keeping their patients happy and well cared for. And that's a beautiful result.